Anant Ambani and his wedding is a talked about topic of this week because of his getting married. And during the interviews, he has revealed that he was a highly asthmatic patient since childhood, and he started taking steroids, especially corticosteroids, which ultimately caused altered metabolism and fat deposition in his body, giving him a very bad weight gain. Now, in our day-to-day practice, we get many young patients with respiratory illnesses very commonly these days, and we have a whole list of remedies with excellent results in homeopathy for cases which are diagnosed for bronchial asthma. So I just wanted to give you a quick preview of bronchial asthma. Now, what is bronchial asthma? Now, this is a long-term inflammatory disease of lung airways which is recurring, causing airflow obstruction and bronchospasm. Now, if you see, the patient will come to you with symptoms like wheezing, coughing, chest tightness, shortness of breath, which are abrupt in onset. Sometimes they will have worsened episode during the night or after any kind of exercise. Now, causes could be variety of causes. It could be genetic, it could be atopy where IgE is responsible, there could be airway hyper-responsiveness, allergens, it could be occupational, maybe patient has, adult patients having passive smoking as a factor, again obesity, could be a result of respiratory infections in past, and of course air pollution. Now, if you see the pathology, the airway is hyperreactive. Bronchoconstriction is there, and there is increase in all the blood cells. A lot of mucus production happens. Airflow is reduced, giving to FeV1 reduction. Now, usually there are two types of asthma which is talked: extrinsic and intrinsic. Extrinsic is usually of early onset, you see in kids, and usually there is some or the other external factor. But intrinsic asthma is also there where the onset is late, and usually it could be because of raised IgE. And patients over 30 years of age will come to you with this. Okay, and if you see the signs, you examine the patient, you'll see accessory muscles of respiration are used. There is pulsus paradoxus, and sometimes, in the acute episode, patient can have depressed sensorium also. Now, you can have wheezing also. Breath sounds will be diminished. Chest is hyperinflating, and you can have stridor as also on auscultation. Now, if you send the patient sputa for examination, there will be raised eosinophil count, mucus plugs could be there, and moderate eosinophilia. On the PFTs, you will see there is obstruction, and spirometry will show reduced FeV1. If the X-ray is advised, hyperinflation and lower collapse could be seen. Now, for differential, you can think of foreign body of aspiration or COPD or chronic heart failure or any airway mass developing. So these are the things which are basic to know as a GP. Now let's see, the prognosis is usually good. Generally, the patient have good prognosis, but how homeopathy can help in these cases? Now we have a list of remedies, and each one of them have their own indications, and we need to take a full detailed case and understand the response of a patient during his acute attack. Now I'm going to quickly give you a preview of some clinical remedies which you can easily use in your practice. Clear indications are there. I'm going to start with Blata. Blata has plus-like mucus. There is a lot of bronchitis. If you think of Grindelia has foamy mucus, and patient will always be aggravated on lying. So usually the night-time patients coming with this complaint. Ictodis fetida, this has anxiety as a very important concomitant, and patient will be relieved on passing stool. If you think of Seneca has cough ending in sneeze. This is a very PQRS of Seneca, and usually aged people, geriatric cases. Okay, Antimonium arsenicum, lot of dyspnea. Patient is worsened on eating and lying. Aurelia, you can think of when patient has aggravation again on lying down. and the cough is very dry, very dry cough. Antim tart, a lot of rattling, key symptom, and usually the patient will have worsened episode during any damp weather or any exposure to dampness. Natrum sulf, the patient has worsened because of some grief and also dampness, and there is greenish sputa, marked greenish sputa. Think of Ipecac. Now usually Ipecac is some of the best remedy, one of the best remedy for first stage of asthma, first stage itself. Spongia, it has dryness, very dry cough, worsened on any kind of mental excitement, and also worsened on eating sweets. Now, bromium, usually people who are on the shore will come to you with bromium-like symptom. Think of Sambucus when it is a midnight time where the patient develops this asthma symptom. Eriodictylon, this has a clear indication when the patient has thickening of the tubes. Bronchial tubes are thickened. Now, besides these list of drugs, two nosodes which I really wanted to give a little more detail today. These are commonly given as intercurrent remedies, which are tuberculinum and bacillinum, for patients who are suffering from obstruction of bronchial tubes by mucus extending to bronchial ramification, causing more and more obstruction. And often they are given in higher dilution. So I'm going to quickly tell you about just basic personality traits of tuberculinum. Now, if you see the children of this category, these are naughty children, disobedient, destructive, restless children, and they desire change. So they keep changing their position. Then they are never sitting at one place. They will change their toys. They even change their friends. They cannot stay with one person for very long. Their schools will be changing. Their choices will be changing. They want to explore more and more. And they are destructive also. So much so that they will do it intentionally. Intentionally, they will destroy very valuable items. They'll throw anger around others, like temper tantrums, and they want to enjoy their life to the fullest. So as they grow, they love to go for adventure tours, trips. They take part in exploring different exciting things in life. So if you understand that this person wants to just get up and wander off to far off places, even not knowing the destination, these are your tuberculinum patients. Now they may not align with their parents, or family members because of this. So if somebody stops them, they may feel oppressed, and they love to ride on bikes, that too on very high speed. That is a very important symptom because they love wind on their face. And they can sacrifice their sleep also for traveling. Now these are very moody, restless people. They can tease, they can have malicious behavior, and they can even emotionally blackmail others. So you see young kids pulling hairs of other, boys and girls in class. Those are tuberculinum. But they also care about their family. They also love their family. But the only thing is that they want to be free. So tuberculinum patients are fond of gadgets, especially those gadgets which help them to explore the world, and they will purchase from big brands. So these people can be solo travelers because again they want to do things on their own way. So they do not depend on family or friends. These people also do not like animals or pets. They may even trouble them. So let's talk about another nosode, a quick review of that personality of bacillinum. This is one of the, again, a very good intercurrent remedy given. Now, bacillinum children, if you see from their parents, they are going to tell that the child has a very poor memory, poor attention span, or very low concentration. So, there is an evident dullness. Even if you look at them, they are weak and shy. They will not be very intelligent, and they may even hide behind their mothers. But in reality, they are mischievous also. At the core, they are mischievous. They can be rude and they can be very hard to others. Disobedient again. So you may see that they don't want to face society. they just have a dissatisfaction from their parents or family members, they eventually become very obstinate and stubborn children, and they're going to talk very rudely with others, answering really badly with others. So if you offend them, they will isolate themselves. This is very key because they are dull and absent-minded. So unlike tuberculinum, which is going to wander because they know the world and they will be very happy on their own, tuberculinum will just isolate and they will not talk and will be very snappish. Now, children coming to us with relapsing complaints, again and again the respiratory disorder, again and again the episodes are coming up, even after giving the best remedies, you can think of Bacillinum. And if there is associated ringworm or alopecia or any other skin complaint, which is again recurring, again a very important indication for Bacillinum. Check for glandular enlargements. And one key symptom of Bacillinum is they have exhausting dreams. So in the morning they will get up and they will feel as if they have seen a really long, tiring dream. So I hope that this information was helpful, and let's enjoy the pictures of Anant Ambani and his wedding happening, and also upskill ourselves for treating cases of bronchial asthma and curing them. Thank you for watching. Please subscribe because I'm coming up with very exciting topics, very trending, important topics for practitioners and homeopaths. Thank you.